US. Good evening. Now we have seen a surge of and other healthcare workers find greener pastures abroad, and this has the backing of government. We're seeing them leaving for the United States, we're seeing them leaving for Europe, and even some to the Middle East. But the big question, if you're interested tonight, how goes the process? Joining us tonight is none other than the MD, KENYAN Nurse Consultants Limited. On the far end, that is Mr. Paul SIMIYU, flanked by Professor REGINA, CALLION, CEO, RIMA Inclex UX. Karibu sana. And I'm glad to be hosting your namesakes. I'm REGINA too, but yeah. Yes. So you're among REGINAs, you're in safe hands, Paul there. Now let's start off with Kenyans want, or rather nurses, or rather those in the value chain, the health care value chain, are seeking placements abroad. Statistics are there, but the question is, where do we start? How does it go about? Let's start off with you, Mr. SIMIYU.
Yes, it's true. The demand for Kenyan nurses globally is actually on the rise. Each and every developed country or developing country is looking forward to have a cake from the kind of nurses we're producing. When you look around, when you move to the US, the demand for Kenyan nurses is actually high. Europe, especially the United Kingdom where I work, we are so needed. Mm-hmm. When you come to the Middle East, we are also needed in large numbers. Locally, yes, we are needed, but the number of nurses who have been produced locally actually are more than the jobs available. And that is why maybe the young nurses who are unemployed are actually benefiting from the support the government is actually creating for relocation for their relocation to overseas.
Mm-hmm. Yeah. Well, on the numbers of those who have trained, in nursing and other healthcare workers, actually it shows that we are understaffed when it comes to nurses, and there's also general concern that with the migration abroad of these healthcare service providers, then we are left, on high demand with less people to take care of us. We'll be handling that, Mr. SIMIYU, as you ponder on that. But then, what are the requirements? Other than just being a qualified nurse, what are the requirements, REGINA? What are you looking for?
Well, in the United States, we love nurses from Kenya. And if you are a registered nurse in Kenya, you can come to the United States in addition to taking an English exam as well as our state exam. It's called the NCLEX. And being able to pass both of those exams, and I'm sure Paul can speak to some other issues, but those are really the requirements.
So you have to be a registered nurse here, but then take an English test and the NCLEX exam. Paul, tell us more about those two requirements.
Yes, for the English exam test, we do understand that locally we've been trained in English from primary school to high school. However, those relocation processes require one to actually meet the requirement in terms of being able to pass the international English exams, which are likely to be 4 or 5. The first one is IELTS, which is International English Exam Language Testing System. Then TOEFL, OET for nurses, or OET for doctors, radiographers. Then PTE. Either of those exams, each and every country will have their specifications in terms of their scores, in terms of their duration, and so forth. For example, if you want to go to US, you can sit for the English exam, that is IELTS, and score everything, that is listening, reading, speaking, and writing, at least more than 6.5 out of 9. And if you're to go to UK, the score might be higher. That is why it's safe for a nurse, before they make that decision, they have to understand the specific country specifications in terms of requirements. For example, Asia, Qatar, Saudi Arabia, they might not require that English specification. When it comes to nursing exam, for you to practice in any country, you must be licensed. Yes. And for you to be licensed, you must sit for that exam. She mentioned about NCLEX, which she does good work in terms of supporting nurses to pass that NCLEX. That is actually an essential tool for those nurses who are going to US, Canada, Australia.
So now, after doing, for you to be actually a registered nurse, you've already gone through the rigors of the training and qualified, to get registered. Now you're saying that we, or other nurses, are expected now to do these English exams. One of them, just to mention, if you're going to be looking to work in the US and the UK and such, are these courses that are also, are we are we looking at a situation where after you're done, you also have, it's like a bridging, or rather building capacity for you to be able to actually take part, or rather get employment in the US? How can we bridge that gap? How can we have these courses then also incorporated in the nursing programs that we have, since this actually already has government backing?
Regina, that's an idea we are working on with Professor Regina. We do understand the demand is not going to actually stop soon. It's going to be actually at the roof. And that is why we are inviting experts from different countries where nurses are relocating to come back to home where they can support us. They're looking through the curriculum, supporting nurses who already qualified, maybe they are just newly qualified, on how they can prepare for these exams. These are international exams. It means you can't just pop in that exam room and be able to come out with a pass. You need someone to be able to support you as you've been training, to train towards that direction. Once you've trained and qualified, how do you prepare? Because there are different strategies. For example, myself, a simple English like IELTS, it's just common English, basic English. However, with my degree, I had to resit up to 5 times. I could have avoided that if I secured someone, a team, to support me to understand what are they really looking for. And that's why, as Kenyan Nurse Consultants, we've gone far and beyond, and we brought one of the best NCLEX trainer locally here to walk around with us so that we are able to support nurses to be able to prepare, and they pass on their first round. And the
so who else are you partnering with? What I'm asking is a majority, looking at the cost of learning, you know, even to qualify to be a nurse, is not a walk in the park for a majority who would be willing to get into this noble practice. Are you working on a partnership that will ensure that as the nurse is taking courses, the normal courses to qualify for her registration or his registration, that they can also learn this, you know, either improve their English and such? If we're thinking of, you know, tapping on this particular opportunity and showing up capacity in the diaspora, is this something that we can explore, Regina?
Yes, absolutely. And I think that's one of the benefits of having a specific pathway to bring you to the U.S., because I'm here representing my country, but I'm also bringing the technology that we use to improve education. And we are working very much to be able to get into universities and reevaluate the curriculum so that the nurses are prepared for success if they choose to go abroad.
Now, security is another question that comes up whenever, you know, anyone is seeking, you know, greener pastures. Then while you're doing consultancy, how are you ensuring that those who are going abroad are actually safe and secure? Because we have cases that have been recorded where people get mistreated, and what they had studied for or qualified for is not the work that they are getting when they land there. How are we ensuring that our nurses get to perform on what they have qualified for? Bwana SIMIYU.
Regina, myself, I'm a registered nurse, trained in Kenya, having practiced in Kenya, having walked the process.
Yes.
And I identified that one challenge that is facing most nurses is lack of information.
Okay.
And that's where people can be easily scammed. They can be easily actually directed in the wrong direction. And it's the reason why Kenyan Nurse Consultant Firm is coming up strongly to provide that information so that people have everything at the fingertips. They are able to know the correct information and the incorrect information. And with that, we are able to stop such cases where nurses are actually lured in the wrong direction. We are also partnering with various entities to ensure that we support these nurses to be able to identify such loopholes and be able to be safe throughout the journey. Yes.
Now, let's just take it down. If I'm a nurse, assuming that I am a registered nurse and I'm seeking employment in the diaspora scope, what's the process? Other than just taking these exams, what should I look out for to avoid being duped?
The government is actually putting in place various measures to also support nurses, and one way it has done so is to institute an institution or a government agency that actually is able to relook through the processes in terms of institutions and the process, that is National Employment Authority, where nurses are able actually to counter-check the name of agencies that are actually officially sanctioned by the government. The nurses are also able to actually confirm from the list of jobs that have already been enlisted. So with that, they are able to work with sanctioned entities to actually apply for jobs that have been verified and proved to be actually genuine and available. Because sometimes if you're on social media, you will come across various kinds of jobs, but they are not actually jobs that are existing. 3, also, nurses also have to be able to actually come out in large numbers and seek information, because information is power. If you are informed, you're likely going to make the correct decision. And that is why we're going around the country to ensure that we are able to sensitize and talk to the nurses to their own comfort homes so that they are able to pick up this information.
Now, what about the culture shock? As we are preparing these nurses, yes, they are qualified, they have done the exams, but then how are we taking them through the culture shock? Because cultures are diverse and such. Are you giving this kind of support to these nurses? Regina?
Absolutely. We understand, even for myself coming here to Kenya, it is different. So we are empowering the nurses to understand American culture. We get paid every 2 weeks in America instead of, I think, here monthly. We speak in different terms. We use time instead of kilometers. And so we are going to prepare the nurses to be successful in their position. We're welcoming them, and we want this to be a great time for them to make the decision to explore opportunities abroad.
Now, SIMIYU, in terms of when someone actually goes out there and, you know, secures that particular job, how are you assisting them now also come back and reinvest what they're earning? Because this is backed by government to shore up capacity of diaspora remittance and also deal with youth unemployment. How are you coming in this?
Yes, a classical example of such a reinvestment, because myself, when I relocated to UK in 2018, I was actually with nothing. So immediately I arrived, I faced the same culture shock, but I managed to actually stand tall. And I acquired some few resources. And that's when I felt like I need also to have more nurses from home to come also enjoy the fruits. And that is when I created the Kenyan Nurse Consultant Company. So as a company, you see, it's providing employment. It's able to support more nurses who are also interested to relocate to different countries. And we are also having groups of nurses and other people in overseas who are interested to relocate back home or who are interested to invest back home. And not only us from Kenya, we also have friends from Caribbean countries, from America, from UK, who feel like Kenya should be their next home. And we are also being the agents of, we are actually advocating for such, in such a way that we are able to tell them how Kenya can be a good country for them when they retire. And soon you're going to see that impact actually being felt on the ground, where people are going to actually use Kenya as their retirement country, as their retirement home. And we look forward to continue to receive government support. And if we have such kind of support, expect lots of reinvestment back home.
Now, let me be the devil's advocate. In May here, we saw a section of critics to this backed plan by government to have nurses seek greener pastures abroad, saying that we need to limit, that government needs to limit the number of nurses who are seeking employment abroad to avoid straining the local healthcare sector. From that particular perspective, what do you think about that particular criticism and call to limit the number of people who are going abroad to seek these jobs?
I'll say that's an outdated opinion. I remember when I was growing up, we were taught this concept of brain drain. I don't think it still applies. Nowadays, it's brain gain. We are too smart to be drained. We are now going there and we are gaining. That is why we are able to send resources. We are sending money every day. We are sending resources, information. We are requesting friends to come from such countries to bring technologies home. So the benefits outweighs the actually perceived challenges or perceived losses that we thought we are incurring when someone relocates from Kenya to either US or UK or Canada. Myself, a classical example, each and every year, I'm sending home more than 40,000 pounds. If I was in Kenya, I could not be saving that. So if we have one person like me, 2 people, 3 people, 100, how much are we sending home? Can that outweigh the perceived negative opinion that when you go to another country, you've run away from home. No, you're going to look so that you bring home. It's just the way we were growing up, that had to go out to bring food.
But it is an investment, so we'd want to know, those who are watching at home would want to know on an average, how much does it cost to get placement as a nurse abroad? You can give an example in the US, where you're working, and in the UK maybe. What does it take, like in terms of cost? Like if you were to make an investment, how much?
Yes, the process is different. For example, if you're looking forward to go to UK, which has gone on a slow mode, actually you need approximately 200,000. And once you arrive, you are able to earn 500,000. If you're looking forward to go to maybe Saudi Arabia, Qatar, close to 150,000. And once you are there, you are able to earn about 300,000. For US, the process might be long and expensive, but the return is also marvelous. For example, if you're looking forward to relocate to US, you're looking for 250,000 to cover the entire process. However, some of parts of the cost will be covered by the employers. Then, once you arrive in the US, you're looking at $1 million per month. Yes.
So it is, when you say someone cost, it's called a cost analysis.
Yeah, we have also to be considerate of such. Yeah.
Now, Regina, as we work towards closing this particular conversation, someone who is watching and maybe they have been struggling to get through these exams and such, just give us a rundown on what they should do better. Just free advice. I mean, you're on the national broadcaster. What can you tell those nurses who have tried severally and they have not come through, or rather gotten through this particular exams?
Understand. I would say that nurses in Kenya already have such a great foundation, and there have been many successful passers of the NCLEX already, so don't give up. But also, it is important to look at how our current test plan is. So myself, I've written a curriculum that nurses can study in about 6 months and during their process of coming to the U.S., and they'll have everything that they need to pass. Content is key. Content, yes.
So this particular curriculum, is it available online? Is it free? Do we pay for it?
It's true, yes. Okay. It is a mixture of physical books, 2 books, and an online training platform where they will find the content of the exam and they will also be able to practice their questions. In the US, we use computer adaptive testing, and that means that every nurse gets an individual exam. No 2 nurses will get the same exam. So it is very important.
Now, before we come to a close, someone has just inboxed us. We had asked this question online, and someone is asking, why do we have to struggle to speak English, yet it's not our native language and we have computers? Bwana SIMIYU, take that out.
Yes, I've got such questions from different nurses and different colleagues. Why do we sit for English when we've been prepared in English since our primary school? I always say it's their rule, it's their policy that if you are relocating to their country to work, you need to be able to function. And communication is a key element in terms of your functionality as a nurse, because you are going to interact with human beings who are patients. The same applies if you're going to, you coming from US and you're coming here to work in Mama Lucy Hospital, you should have some basic elements of Swahili for you to actually be able to understand that Mama who is sick. So that is their policy. And I look forward to Kenya also coming up with a policy where people who are coming from overseas to come and work, not tourists, of course, because tourists need to come every day, if they are able to be also examined in Swahili.
Yes, so that we can also have a pro quo. You know,
it's a source of revenue for the country, you know that?
Indeed.
Yeah.
Now, we have been speaking to 2 panelists this evening, just trying to unpack the process and what is required for you to tap that particular space if you are in the healthcare sector, or rather value chain. On the far end has been Paul SIMIYU, who is the Managing Director, KENYAN Nurse Consultants Limited, who said that we need to, build capacity to be able to tap into the diaspora space in terms of healthcare. And Professor REGINA, who is the CEO at REMA NCLEX US there, saying that there is need to build capacity and work together with those who have already gone before you so that you can be able to get through these particular exams. And I am Regina Manyara, have been your host tonight, assisted by none other than Lady Lucy Maura on sign language interpretation. Enjoy your evening. Just remember tomorrow is going to be Mazingira Day, so kindly plant a tree. Have a good night.